Hello, everyone. I'm Teresa Killam, and for those of you that I haven't yet had the pleasure to meet, I am one of the low-risk maternity physicians at the Riley Park Maternity Clinic and the Foothills Hospital. I regret that I am not able to attend this conference in person today, but I'm very grateful for the opportunity to still briefly touch on the very important topic of a mindfulness practice and share a little bit of my experience with practicing mindfulness and also offering it to patients as a tool to help with whatever they might also have going on in their lives during and after their pregnancies. A big shout out of thanks to Jan and Kelly and Jenny and everyone who planned this day of education and collaboration. And also just a side note of thanks to my own children who used the 3D printer to make the beads for the sizes of baby's belly for your goodie bags. They were very excited to contribute to this project as well. So, what is mindfulness? Mindfulness, as defined by Jon Kabat-Zinn, who you can find information about anywhere online, at the library, on Masterclass, on apps. He was sort of the father of mindfulness in medicine. And he defines mindfulness as paying attention in a particular way, on purpose, in the moment, non-judgmentally. Importantly, mindfulness is a type of meditation. So if meditation were dogs, then mindfulness would be a golden retriever, a type of meditation. And it is very particular that it is not a form necessarily of relaxation or guided imagery or progressive muscle relaxation or time to take a nap. Now, all of those ways of relaxing or meditating are also very beneficial for our health, but they're not the same as mindfulness specifically, which is taking a moment to pay attention in a particular way, on purpose, in the moment, without judgment. The reason we talk specifically about mindfulness is there is a large body of evidence behind a number of the benefits of a regular mindful practice. And so they've studied, multiple studies have been done on groups of people, including medical professionals, on the benefits of a regular mindfulness practice, which does include approximately 10 minutes a day for 8 weeks or more. And that type of practice changes our physiology in our brain to improve a number of aspects of our own well-being and the way that we care for and interact with others. So there's evidence that a mindfulness practice increases our ability to pay attention, to have good self-awareness of our own self, to give us skills for emotional regulation, which, as we all know, in these very trying and stressful times as COVID, that emotional regulation skills are needed and appreciated, not only by us as healthcare providers, but also for our patients who are experiencing these same stressors. Interestingly, a regular mindfulness practice is also known to increase the length of our telomeres, which are the caps at the end of our chromosomes that protect our chromosomes from mutating and aging. And I think it's fascinating that the ability to be present in the moment and ask our minds to not think in the future and not think in the past, but pay attention in the moment, has such a physiological benefit as actually even protecting the length of our telomeres. That research, interestingly, is done by mostly Linda Carlson, who is a local U of C Calgary researcher in the Cancer Center who has done a number of studies on mindfulness practice in breast cancer survivors. Now, very importantly, if we learn to practice mindfulness ourselves, it not only increases our attention and self-awareness and emotional regulation, but it also increases our ability to have empathy for our patients and for those that we care for. There's also substantial evidence that treating burnout in healthcare providers, such as nurses and physicians and nurse practitioners and lactation consultants, which we are all at risk for in our very intense profession, that mindfulness is a true intervention with evidence for decreasing, preventing, and treating burnout. So for us to practice it ourselves has a number of benefits. Importantly, if we practice it ourselves, we also have the ability to support our patients to learn how to practice mindfulness for themselves. And there's also very strong evidence that a regular mindfulness practice can treat mild to moderate anxiety and mild to moderate depression. So when we become familiar with mindfulness practices, we can offer it to our patients, particularly those who are antepartum or struggling with anxiety or stressors or depression or mood concerns. It may not be the only thing that they need to help support their care, but it certainly can be one tool in the toolbox that has a number of benefits and no risks. It's 100% safe and there's no side effects, which is very appealing to our pregnant, postpartum, and breastfeeding patients. So how do I practice mindfulness, for example? I actually really love to use a lot of the apps that are out and available for mindfulness. Headspace, for example, is an excellent app, and it's also on Netflix, so it can be accessed through a Netflix subscription. There's the Calm app, which is very popular and has a number of mindfulness meditations that are guided, but also a number of sleep stories that patients with insomnia also find very helpful. There's Waking Up with Sam Harris. There's the 10% Happier app. There's the Smiling Mind, the Brain Gym. I could go on. There's resources all over the place for accessing, learning how to practice mindfulness regularly through guided programs so that we can acquire those skills in that practice. The other way is to just do some exercises throughout our day. And one of my favorite mindfulness exercises is see, hear, and feel 3 things. So in this, you can also teach your patient, especially if they're having a moment of anxiety or stress or just are triggered by something and they need to engage their parasympathetic nervous system to activate that sense of calm and emotional regulation. So, for example, you would say in your mind, no one needs to know that you're practicing these things in the moment, 3 things that you see, 3 things that you hear, and 3 things that you feel by touch. And if you just take that moment to settle into that and ground yourself, you are actually practicing mindfulness in that moment and causing that sort of strengthening of all those physiological benefits that come with it, and getting the benefit of just feeling better for taking a moment to allow yourself to reset. I know that we all work in a very busy and hectic environment, often running from room to room with varying levels of acuity and needs for our patients. And sometimes I find the most helpful thing is to have a brief mindful moment where when I'm walking down the hallway, I'm only just thinking in that moment about walking, feeling my feet hit the floor step after step, seeing the halls around me. And then when I get to the room for the patient, I'm actually reset and ready to care for them with full compassion and full attention for what they need. And you know what it's like. We go from a room with a postpartum hemorrhage to a room with a shoulder dystocia, to a room with something tragic occurring, to a room where someone's social circumstances are devastating. And we need to be able to help ourselves reset between each of those patients. And we can actually practice a moment of mindfulness while we're walking to that room. Or we can grab the door handle on the room in the way in and just take a pause, take a breath, be in that moment, and allow ourselves that reset so that we can fully pay attention to the patient in front of us. A lot of people tell me that it will be hard to practice for 10 minutes a day, every day for 8 weeks to get the benefit of mindfulness. But you can do it through these little ways: touching the door handle, walking down the hallway, see, hear, or feel. You could also take a mindful shower, where instead of thinking about what you have to do in the day ahead of you, you're actually really in the shower, feeling the water, the steam, the smells of your shampoo. And that is has the same benefit as a sit down and listen to a podcast kind of mindfulness practice. So this is just an invitation to consider mindfulness in your own toolbox of skills that you can build for yourself or continue to build for yourself to increase some of your own wellness, and certainly as something that we can offer in a safe and supportive way to our patients. Thank you for joining me and listening in. If you ever have any questions, grab me on the unit or in the clinic. I would love to happily share more evidence and information about mindfulness at any time. And otherwise, I hope you enjoy the rest of the day today. And all the best, you guys.